following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 9 of Ask the Behavior Doctors. I am Dr. Jacob Boney here at Scottsdale Pediatric Behavioral Services here in Scottsdale, Arizona. We'd like to welcome you to this episode. We encourage you to continue submitting these questions to us at info@scottsdalepbs.com. We are here to be your experts. We want to answer your questions, provide you with information, and really be your go-to source of behavioral science info. So today we're going to answer a common question from my parents, but one that is a little bit more complex than it seems. So the other day I was at a restaurant and I'm there, eating with a friend, and I see this dad with his young child who's a little above 2, and the child can talk, and this child is screaming and he's crying and he's tantruming, and this dad is there holding him, comforting him, rocking him like a baby, having a full-blown conversation with him. And I mean, this child is squawking, screaming to the top of their lungs in this restaurant. And all of the people around in the restaurant are looking. And my friend looks at me and he says, what would you recommend to someone that has a baby crying? Like, it just seems like a tough situation. What should a parent do if they have a child that's crying? So number one, I want to clarify, I'm talking about older children here, 2 or above, that, or 1.5 and above, children that can talk, can communicate. I'm not talking about little babies. Babies obviously cry primarily because that's their primary form of communication. I'm talking about children a little bit older that can talk. So let's say generally 2 and older. I wanted to give some recommendations to parents so that you guys have a plan of what to do if you have a young child who does tantrum or does cry frequently out in public. So this could be anywhere. This could be in the store. This could be in a restaurant. It could be anywhere. So number one thing to do is prevention is the key. Read your child's mood. Know your child. If your child is in an awful mood, you know they're going to scream and tantrum, you know they're going to cry, reduce those opportunities. Remember, parents, everything you do with your child, everything you do to your child is a conditioning process. So if you constantly bring your child to places when they're upset, when they're moody, when they're having a bad day, and they constantly have meltdowns in public places, you're training and conditioning them that that's what they're supposed to do when they go out in public. So parents, prevent those opportunities as much as possible. I understand, parents, if you're busy, if you have your child with you, you have to stop by the store. I get it. Life gets busy. Sometimes you have to bring your kids with you. However, if you have any amount of control, any level of choice in the situation, I would recommend minimizing those opportunities, because remember, they are conditioning opportunities. Minimize those as much as possible. And you can even minimize the frequency and duration of the trips. If you know your child's in an awful mood, maybe you can just plan to go on that big grocery shopping trip later when your partner gets home, or later when you have a babysitter available. Maybe just go to the convenience store immediately. Going to the convenience store may be a little easier for your child than going on an extended shopping trip. I want you to start small, parents. Start small with short, quick trips out to the store. Your child needs to learn certain skills that will help them be able to behave well out in public. Again, any kind of place, store, mall, grocery store, convenience store, anywhere. Start small. Start with small, quick trips, probably to the convenience or drugstore, something that's going to be in and out. Make sure your child has the following skills, and if they don't have these skills, we need to work on them. Number one, they need to be able to follow directions. You need compliance with your child, especially out in public. You need to be able to tell your child to do something and they generally follow that direction. Number two, they need to be able to stay close to you. If your child elopes or runs from you constantly, that's a dangerous thing to do, and it's a dangerous habit to get into in public. So you want to make sure your child has the skill to stay close to you. Accepting no. If you can't tell your child no and they can't have a decent reaction to that, maybe they're just not old enough and maybe you haven't practiced enough to have them going out frequently into those public places. So you should be able to tell your child no and they not have a major blow up or tantrum over that. Accepting removals. If your child picks up an item or has something and says, hey mom, can we get this? You should be able to say, no, we can't. Let's put that back and let's keep going. If they can't accept those removal of the items and they're going to have a big blow up over that, probably a good indicator they're not ready. Transitioning between aisles and items. So children need to be able to let go of things quickly and transition pretty fluently. So if your child can't see an item and then get off of that item quickly, then it's probably an indicator it's something we need to work on. And then not only transitioning to items, but transitioning back to the car and back to another location would be important. So following directions, staying close to you, accepting no, accepting removals, and being able to transition are all skills that your child needs to be able to go out into public and not have these crying tantrum fits. If your child cries or tantrums every outing, that's your first indicator that parents, maybe you need to start smaller. You need to reduce the frequency and duration of those trips. You got to start smaller. Bring your child out when they're in their best mood. Give them opportunities to be good in public places. Don't bring them out when they're at their worst. Try and bring them out when they're at their best. And again, if worse comes to worse, maybe you just need to practice those skills at home before spending significantly amount more time out in public. If you are out and your child starts to cry, okay, the very first thing you need to do is you need to limit your reaction. When I say limit your reaction, limit your emotion, limit your tension, limit your words, limit your eye contact with them. You're not mad that your child's crying. You're not mad that your child's tantruming, but you want to limit your reaction in response to that. You certainly don't want that crying, tantruming behavior to be able to evoke a consistent response from you that basically becomes what a counter control technique is what we call it, that your child wants you to change your behavior, so they're going to start crying and tantruming to do that. So you want to limit your reaction first thing. Next thing you want to do is you want to quickly, with as few words as possible, figure out what your child wants. You have 10 seconds to do this. And I say 10 seconds because remember, if you're in a public place, other people are watching you and your child. And the problem with that is that even if you're not giving your child attention, if other people are, that behavior is still being reinforced. It's called extraneous types of attention. So, but even being reinforced extraneously by outsiders still makes that behavior more likely to occur in that environment. So as quickly as possible, with as few words, try and figure out what your child wants. If you think they're hungry, if you think they're hurt, if you think something is, you can ask them quickly. But if you can't figure out in 10 seconds, then what needs to happen is you need to get your child, either pick them up, take their hand, and you need to remove them immediately to the quietest place with the least amount of attention available. You need to make sure this is a safe place. You need to make sure it's generally close to where you are. But what you're trying to do is you're trying to limit the amount of attention, limit the amount of disruption they can cause. Remember, we don't want to condition your child to tantrum and cry in public places. It's bad conditioning. It's a bad habit to get into. What you're really trying to do is make that behavior as non-valuable as possible, and you're trying to prevent any form of reinforcement. What it's called is you're trying to put the behavior on extinction. So again, I say you have 10 seconds. Do not have extended conversations with your child when they're crying or tantruming during this time, okay? And do not keep them in a crowded environment where people can extraneously pay attention to that behavior and reinforce it. Those are the worst things to do. You will never talk a child out of crying and tantruming appropriately in an environment quick enough. That's not the appropriate way to get your child to calm down. It's going to create a negative conditioning process, okay? So parents, you're trying to put that behavior on extinction as quickly as possible while simultaneously reinforcing one of two things. You either want to reinforce your child being quiet and calming down, or you want to reinforce your child using what's called a functional communication response. They need to tell you with their words what they want, even if it's just a simple word. I want my toy. I wanted this piece of food. I don't want to sit next to my brother. I want access to this, whatever. You're trying to reinforce one of two behaviors, quietness and calm, or using their words to ask for what they want. So parents, you're allowed to prompt that behavior. So remember, you have 10 seconds once your child starts to do this behavior. If you can't figure out in 10 seconds, you immediately remove them. You're ignoring the behavior, but not your child. What you're to say immediately is you to say, hey, I want to help you, buddy. I want to give you what you want. What do you want? Tell daddy what you want. Tell mommy what you want. Okay? So you're trying to get that from them. You're allowed to prompt that, to use your words. Or you can say, you know what? I know you're upset right now, and daddy will talk to you as soon as you start to be quiet. I promise you. I can't wait to talk to you. As soon as you're quiet, I'll be able to. So you can prompt that every 3 to 5 minutes. But until your child starts to either get quieter or use their words, you are to minimize any type of attention in that moment. The worst thing to do is to hold, coddle, have a big, drawn, long out conversation with your child when they're in that mode. The reason is that's not very natural. Number one, that anybody screams, cries, and is held and is comforted, and they have a long, drawn-out conversation when they're screaming and crying. But number two, it's a bad habit to get into. You condition your child that that's an appropriate way to interrupt mommy and daddy, to get all of the attention on them, and to get all of their needs met. That's the last thing we want to teach your child. We don't want them to think that that's the way. We want them to make an appropriate request. We want them to say, hey, as long as you just ask mom and dad, we'll give you whatever we can. We'll give you whatever is available, whatever is appropriate to have. But crying and tantruming is not the way to get your needs met. It's just not. And that's why we have to be very cautious about how we teach and train our child. So again, you've made that decision to remove your child. You've prompted that, hey, as soon as you're quiet or as soon as you use your words, mommy or daddy will give you exactly what you want. Now, what I also want you to do during this time is if you notice your child calming down in any way, you notice a decrease in their volume and their intensity of crying, I want you to notice that behavior. Hey, buddy, I see you trying to calm down right now. You're doing a really good job. Daddy's really proud of you. I know you're upset with me right now, but I can see you trying to be calm. Remember, you get the behaviors you reinforce. By calming that de-escalation process, you are making it obviously more likely that your child's going to be able to make good decisions. You're making it more likely that your child's probably going to be able to talk to you, use their words, and make an appropriate request. I tell parents this all the time. It's about calming them before you expect compliance. If your child's upset, crying, and tantruming, expecting compliance in that moment is not the number one priority. You want to reinforce and shape a calming process, then expect compliance. Parents, a couple just really quick tips with this. Be quick. Be quick to pull the trigger. When you're quick, you condition quick changes in behavior. When you are really quick with consequences, you condition quick shifts and quick changes in that behavior. If you constantly let your child sit there, scream and squawk and have a full-blown tantrum for 20, 30 minutes, that's called a response cycle. You condition your child that each time they're going to get upset, they do that for 20 to 30 minutes. However, if every time your child cries, you quickly respond with this prompting functional communication or removing the child, they're never going to be able to go through that full response cycle. They're never going to have a chance to be conditioned that that's appropriate. So be quick, parents. Pull the trigger quickly. I tell you, you have 10 seconds in that moment to figure out what your child wants. If you can't figure it out, remove them immediately. Remember, you're trying to extinguish that crying behavior, make it as least valuable as possible. You want that crying behavior to be useless. Would you cry in a room all by yourself if you knew no one would ever hear you and you knew it would never make any difference in what you were going to get? You'd probably be a lot less likely to cry. So here's what we want. We want the child to know crying is not valuable. Crying is not going to get them anything they want. However, if they're just quiet or if they ask, they'll get exactly what they want much quicker, much easier, much more efficient. That's what we're trying to teach the child. So be quick, be responsive. Any shifts in your child's behavior should occasion a shift in your behavior. So what I mean is, as soon as your child starts to make good choices with their calming response, you need to immediately turn from a robot into a really nice, attention-filled parent. You need to be really soft with them. You need to be, oh my gosh, just make a very big deal out of any attempt to go in the good way with their behavior. Be responsive. Be very attentive. Be very, very quick with that change in your demeanor as soon as they start to change in their behavior. Remember, parents, you're not mad at them. You're not upset at them. You're just there to help them make the best choice possible. And as soon as they start making good choices, you're going to give them exactly what they want as quickly as you can. That's the mindset you're bringing to it. The last recommendation here is be a robot for naughty behavior. Take the tension and emotion out of it as quickly as possible. So remember, parents, you got that 10 seconds to figure out. As soon as you have to remove the child, no tension, no emotion, no nothing. You've turned into a robot. You're not mad. You're neutral. Your affect, your tone, your facial features, all of it, it's just neutral. As soon as the child starts to behave in that positive way, that's when you're going to get to be awesome, cool, nice parent. You're going to get to be so friendly with them. You're going to get to have that affect, that emotion, that energy to your presence as soon as they start to give you the behavior that deserves that. So, ladies and gentlemen, that brings us to the end of our episode 9 of today. I want you to please continue to submit your questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. And we want to encourage you to continue to submit those questions to us. And we want to thank you, of course, for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.